Hello friends. So today I'll be talking with you about GERD, that is gastroesophageal reflux disease. So make it simple. It is gastro means stomach, esophageal means the food pipe, and reflux disease, which is the stomach content goes in reverse direction to the food pipe and leads to the problem, that is symptoms. So say for example, this is the place where your eaten food goes inside into the food pipe and which falls into the stomach, and stomach is carried forward into the duodenum, that is small intestine. Now once you eat, the sphincter at the junction of food pipe and stomach opens up, the food bolus goes into the stomach and then it closes down. Sometimes if it remains open or it abnormally it relaxes or weakens, then what happens is your stomach content, the acidic content where the pH is very low, goes into reverse direction upwards into the esophagus. Okay, that can again happen due to the hiatus hernia here at the diaphragm level. Once it goes above, it leads to damages into the esophagus, that is the lower part of your food pipe, and that leads to many symptoms. Now hope you understood this diagram. Now the symptoms, because this reflux are mainly the heartburn, the burn which happens in the mid chest area. There are so many other symptoms like pain in the abdomen, burping, belching, bloating of the abdomen, and there are few atypical symptoms like cough, breathing difficulty, chest pain. Sometimes even patient goes to emergency. The GERD patient goes to emergency as a cardiac patient, and finally it turned out to be only gastritis and not the cardiac pain, not a angina pectoris. There are so many different aspects of this disease. You must understand, other than the symptoms, you must understand how can you avoid or cure the symptoms. Once you have the symptoms, you must see a doctor to confirm that this is GERD and not any other problem related to pulmonology or cardiology. And once it is confirmed with endoscopy or pH manometry or some other diagnostic tools, then the treatment remains either conservative or surgical depending on the stage of the disease and the severity of symptoms. So we are not talking much about the surgery which is available with us, that is laparoscopy. We do the fundoplication. So I will be talking more on the preventive aspect and the conservative treatment of it. So preventive aspect, you have to avoid taking large meals in the evening. Okay, try, if you are suffering with this disease, try to take early meals, that is before 7 o'clock or before sunset. After that, if you are hungry, take very small quantity of meal or liquids. You must avoid smoking, taking tobacco, and alcohol consumption. Especially while taking alcohol, people come with in emergencies because they have so many side dishes which are fried items, which must be avoided again, especially if you are suffering with this disease or if you have few symptoms of this disease. Again, this disease also comes with few drugs, and mainly they are painkillers, that is non-steroidal anti-inflammatory drugs, NSAIDs. So try to avoid those drugs also. So with every and any pain, it's better to see a doctor rather than taking drugs on your own or asking some medical pharmacist to prescribe you drugs. And there are few other lifestyle modifications which are really required. You should go for early morning walking, evening walk after dinner. Don't go to bed immediately after your dinner because the reflux will be more. Try to keep your bed slightly above, like 30° up, head up position, so that the gravity takes the food material down and there is no reflux of acid content also. And lifestyle modification also includes the exercises. Obesity is another risk factor to lead to this disease. So try to keep your weight in a good range, and you should not become overweight or obese. During pregnancy also, GERD is very relevant, and it increases the chances of it, because the intra-abdominal pressure also increases during pregnancy as the uterus and the fetus enlarges. So that leads to the back pressure generation, and the stomach contents goes to the food pipe. So during all this period, and whenever you have symptoms of GERD, please do stress management, because whenever you have stress, there is lot of production of acid in the body, and that leads to reflux as well. So you must relax your body physically and mentally as well. For that, you can try out yoga, you can try out stretching exercises, and obviously you can sometimes even join the gym. Morning exercises always helps, and avoid eating very spicy food, avoid eating western food, which again leads to more of GERD symptoms, especially in Indians, and avoid taking chaat items and outside restaurant foods, especially when you are suffering with GERD. Hope this information is valuable for you. You can always contact us, and the surgical options are laparoscopy and endoscopy, which are happening, and which is quite easy if the severity of disease is very high. Thank you so much.